Well, good afternoon, folks. As we've got some folks who are joining us from the waiting room, it's good to see you all. And I don't know where you all, I recognize some names who are who have just joined us. So recognize you if you're joining us from what's kind of a rainy, dreary day here in Richmond. But if you're somewhere sunny and warm, good for you. Oh, not the case here, though. Well, all right. Well, I want to be respectful of everybody's time, our special guests today, and also for those of you who are joining us. So I've got my teammates who are going to keep tabs on our waiting room here, but I did want to go ahead and officially kick things off with everybody today. First and foremost, my name is Pam Lowe. I am the Senior Director of Development here at the School of Nursing, and I'm charged with everything related to development and alumni relations. And it's really great to see you on the call today. And I also just wanted to invite any of you all who are interested in using the chat feature, if you are comfortable doing that, just to say a quick hello and your affiliation with the School of Nursing, whether you're an alum or a friend, serve on one of many VCU boards, for example. We just appreciate knowing who's joining us today, and you know how you're friends with us and how you're friends with VCU. All right. So for today's virtual event, we are excited to have a couple of our faculty and folks with us today. We have Jane Chung. Dr. Chung is assistant professor in the Department of Family and Community Health Nursing. We also have Dr. Rachel Wood, who has recently been hired as an assistant professor in the Department of Adult Health and Nursing Systems, and who also worked alongside Dr. Chung as a research assistant, and we're pleased to have them as our featured guests today. They're going to be discussing research on supporting aging populations using smart speaker technologies. So it'll be exciting for me to hear about this. I get to hear and learn a little bit about this, but interested and excited to do a deep dive. And I wanted to acknowledge that Dr. Chung's research, excuse me, has been supported by the National Institute on Aging, and as well through the Firestein-Brezhnev Innovations Grant Award, which is generously funded through generous donations by Lisa and Steve Firestein. And before we get started and I hand things over to Jane, I just want to go over just a couple of housekeeping items. You'll see that we are recording today's event. This is so we can share the event with folks who were not able to attend. And also, I'll let you know that after Jane and Rachel have gone through their presentations, we will be happy to take questions from any of you. And at the end of the event, you'll be able to either take yourself off mute, or during the event, feel free to, if you prefer to send me a private chat or one of my teammates a private chat, you're welcome to do so. And with that said, I have my couple of teammates who are on the call today and assisting. And one of them, Laura, if you'll give a quick wave. Excuse me. My daughter gave me this gunk a week ago, so I thank her. Laura is our alumni engagement coordinator. She works on connecting and engaging nursing alumni to our school, and she's the one who has spearheaded today's event. Pardon me. And Catherine, give a quick wave. Catherine is our scholarship and stewardship specialist. She handles our scholarship process and coordinates with our scholarship recipients and stewardship initiatives. So from here, I'd like to go ahead, hand things over to our special guests, Jane Chung and Rachel Wood, and let you take things from here. We'll see you on the end of things and answer questions that come up. All right, Jane, take it away.
Okay. Thank you for your wonderful introduction, Pam. I'm really really honored to be here and to present my research about smart speakers for older adults. As Pam said, I'm an assistant professor in the School of Nursing, and I introduced myself as a gerontechnologist who does a research on both aging and technology. So I'm interested in doing research on everything about technology, especially focused on developing, implementing, and evaluating smart home systems and wearable sensor technologies to help older adults maintain their health and wellness in the home and community settings. So today I'm going to talk about some of my research projects that's related to smart speaker technology. Okay. Before I get started, there are a couple of things I'd like to acknowledge. First of all, I'd like to thank my study participants and several staff members from senior housing facilities that we have been working with. So without their support, it would not be possible to complete the research projects that I'm going to talk about today. Second, I'm going to mention some of the technology products in my presentation, but I have no conflict of interest, especially financial interest. And third, I'd like to acknowledge the funding support from the NIA, VCU Firestein Innovations Award, and VCU School of Nursing Dean's Research Support. Lastly, I'd like to thank my team members who have been critical to the success of this line of research, especially during the COVID pandemic. And this is a multidisciplinary team. I'm so honored to be able to collaborate with these wonderful team members. And these are faculty members and students from nursing, gerontology, and occupational therapy. And I'm glad to have my colleague, Dr. Rachel Wood, here today, who will share her experience of working on one of my smart speaker projects after my presentation. Okay. So let me start with some challenges of an aging society. As we all know, the number of older adults is rapidly increasing worldwide. As individuals age, they face many health-related changes like multiple chronic conditions, sensory impairment, social isolation and loneliness, disability, or poor quality of life. And the aging population continues to grow, which increases healthcare costs and places a burden on the overall healthcare system and the society. Unsurprisingly, most older adults do not want to move out of their homes and wish to remain at home for as long as possible as they get older. However, older adults are disproportionately burdened by isolation, chronic disease, cognitive impairment, and functional decline, which makes it difficult for them to maintain their independence and safety. Here, I want to introduce the term aging in place. Probably many of you have already heard this term before. So CDC defines aging in place as the ability to live in one's own home and community safely, independently, and comfortably. But older adults may have concerns about safety, getting around, or other daily activities. It is well known that aging in place improves older adults' quality of life and their physical health. And it is often viewed by policymakers as a way to avoid the costly option of institutional care. In light of this situation, technology is frequently regarded as a means to support aging in place, as there are many assistive or consumer health technologies that can address some of the challenges older adults experience. We know that there are various types of technology out there, and there are technologies specifically designed to support aging in place, such as emergency help systems, vital signs, remote monitoring, and fall detection sensors. I put the term aging in place technology here, and depending on the type and purpose, it can be called smart home systems or connected home devices. Regardless of what term we use, I'm talking about the technologies that have the potential to support older adults. While many technologies are available right now, They are not well integrated in older adult care, nor accessible to many older people. But I feel it's important for you to know about them, what are out there. Also, please remember that a technology that may help one person, one family, or be implemented in one particular setting may not be helpful to another. So understanding how to place a technology in older adults' care is essential. Among various types of consumer health technologies, digital voice assistants have been emerging as one of the solutions to mitigate issues older adults face. This is one type of artificial intelligence, AI technology, that may improve the lives of older adults in the home setting. So you probably know the Apple Siri, Amazon Alexa, or Google Assistants, right? These are the examples of the popular voice assistant technologies these days. And these are embedded in smartphones or dedicated home speakers. How it works. So the software consistently listens for a keyword to wake it up. For example, you need to use a wake word like Alexa to use the Amazon smart speaker called Echo Dot to start a conversation with the virtual agent. Once the technology hears that wake word, it records the user's voice and sends it to a specialized server. Then the voice data is processed and interpreted as a command. Users can do many things using the voice assistant, from asking simple questions to playing music, to dialing their phone or turning lights on and off via voice control. The number of services or tasks that support voice commands is growing rapidly, and many manufacturers are also building voice control system into their products. So voice-operated smart speakers can be effective tools to address aging-in-place needs of older adults. Here, I want to talk about some actual or potential benefits of using smart speaker-based platforms in older adults' daily lives. Traditionally, older adults have limited access to conventional computing devices, even though this is much better now than before. Because voice technology works through voice commands, older adults can easily use smart home devices that are connected with smart speakers. Or they can enjoy conveniences that are possible through simple tasks, such as information checking or setting up daily routines. Second, smart speakers offer the potential to help older adults maintain health and wellness, for example, by compensating for memory issues like sending medication reminders, or providing health education and advice, and sending voice prompts for reminding them of healthy eating or exercise, which can aid in self-management of chronic conditions. Third, older adults can enjoy the conversation with the voice assistant or keep in contact and communicate with other people. This would be especially useful for those with limited vision, mobility limitation, or impaired hand movement. Also, the voice agent Alexa itself can be a social companion to some people, regardless of whether you like it or not. Last but not least, older adults can search information, check the news, enjoy quiz or trivia features, all of which can enhance their entertainment and learning opportunities. So for these reasons, smart speaker technologies are considered innovative ways to tackle various challenges of older adults. If these types of technologies are to support solutions for independent living and healthy aging, their acceptability with older adults must be understood to promote technology adoption and use in this population. We all know that people may reject new technologies due to usability issues, lack of technology skills, insufficient training, or privacy concerns and low self-efficacy in technology use. Also, there's an important consideration that technology adoption and diffusion for older adults might not be the same as technology acceptance for other age groups due to unique characteristics of this population, such as aging-related physical changes or some less exposure to novel technologies overall. Also, we need to remember that technologies may not function in the same way as they do with younger users, because older adults may move more slowly, have different adaptations, or apply different logic when faced with technology choices. So to ensure the optimal use of voice technologies for older adults, we need to address the issues of technology acceptance and consider factors that could affect people's technology acceptance and use. From here, I'm going to share some of the findings from 3 research projects focused on smart speakers. The first one is called Alexa Evaluation Project, which was conducted 2 years ago with community dwelling older adults who are living alone in low-income senior housing. Dean's startup funds supported this project, and I really appreciate her generous funding support for my research. So let me share some background of this research. So I closely work with the Richmond Health and Wellness Program, which is a community-based wellness and coordination services provided by VCU faculty and students. They provide the services at several housing buildings in Richmond. And through the RHWP, my team was able to establish a great relationship with the community. And this is one of the projects we conducted with one of the senior housing buildings in Richmond. So starting in December 2019, one of these housing buildings started deploying the Amazon Echo Dots, one type of Amazon smart speakers, in their individual apartment units at no cost. And you can see the photo of the Echo Dot in the top right corner on this slide. Before technology deployment, my colleagues and myself were invited by the housing management to an opportunity to evaluate the implementation process. So we met with them and community advisory board members who were residents of the building to set up a plan for implementing the technology and evaluating the implementation process. As part of the evaluation, we conducted an in-person survey to ask questions about their perceptions of smart speaker use, such as their motivation, perceived ease of use, self-efficacy, perceived usefulness of some smart speaker features, some concerns about cost and privacy. After they used the Echo Dot, the smart speaker, for about 2 months, we conducted another survey to ask the same questions to see how their perceptions changed over time. 47 residents participated in the pre-installation survey, and we had 29 participants for the post-installation survey. The dropout in the number of participants was due to the COVID pandemic. We lost several residents at post-assessment, and 64% of the residents were self-identified as Black or African American. Here, I want to share the pre and post-implementation survey results. So this is a table summarizing the percentage of the participants who answered yes to each question. And what we found is that before they used the speaker, the majority of the participants held positive thoughts about this new technology. So they were basically very excited about this opportunity. And they thought it would be fun to ask Alexa questions, it would be easy to use, and they felt confident in using a smart speaker. And most of them answered that they would ask Alexa for help, and that they would ask for help if they had a question about how to use the device. We tested for statistically significant differences in positive responses between 2 time points, pre and post, and the items marked with a star had a statistically significant difference. So you can, So you can see that the proportions of yes response were about 80%, above 80%, both pre and post use for 2 items, ease of use and confidence in using a device like Alexa. After technology use, a significantly lower proportion of respondents answered that they would ask Alexa for help if they had a question, and ask for help if they had a question about how to use the Alexa. And this finding may reflect confusion or frustration with the device among our participants, which indicate the need for providing technology training or education tailored to their needs and characteristics. This table shows how participants perceived each of the potential or actual smart speaker features. They thought that this device has the potential to be used as a medical appointment reminder, medication reminder, daily living assistant tool, or a system providing health tips. Also, the proportion for the two questions regarding a safety feature was high. In terms of privacy concerns as a potential barrier to smart speaker adoption, when you look at the bottom line, less than 20% of participants answered, I'm sorry, it's automatically moving to the next slide. Less than 20% of participants answered they would feel uncomfortable to think the technology monitored their activities. The comparison of 2 time points revealed the declines in most of the survey items, but they were statistically non-significant. And there was an increase in the proportion of a yes response to the third item, the intention. Oh, I'm sorry. So the intention to use the technology as a helper in a daily living, although the difference in yes proportions between 2 time points was not that different. This result suggests that the participants regarded daily living assistance as a particularly helpful feature of the device after technology use. And it is worth noting that participants favor the ability to use the technology as a safety tool, like harmful event notification systems such as falls, because all of them were living alone. The proportion of the yes responses to these 2 questions was slightly decreased at post-use compared to the pre-use responses, but it's still high, above 75%. So overall, this study shows the acceptance of voice technology. And while there was a decline in the level of perceived usefulness with regard to some key features after they had used the technology, most of the participants still felt the technology was easy to use and they had confidence in their own ability to use the technology. Okay, so after these surveys, my team decided to ask in-depth questions to learn more about what factors we should consider when we are planning on smart speaker implementation in the low-income senior housing setting. So we conducted a qualitative study as a follow-up. For this project, we worked with 3 groups of stakeholders, including low-income housing residents, housing staff, and voice technology developers. And this slide shows our recent publication that reports the findings from this qualitative study. Because this paper covers a lot of content, I just wanted to share a couple of quotes from the interviews that speak to the benefits of voice agents and this type of smart speaker. So the 2 quotes you can see here speak how helpful it was to use the speaker in terms of social connectedness and emotional well-being. And we heard several times that having daily conversations with the voice assistant Alexa had an impact on their feeling of social isolation and loneliness. Also, some folks reported that they are feeling it's much better now with the Alexa. Here's another aspect of benefit. So most older adults, as I said in the previous research, they appreciated the potential safety features of the smart speaker, such as emergency notifications that could send a message to their family members or housing management. And these comments were made in the context of living alone because they had to rely on themselves without immediate assistance from family members. Here you can see another quote from one of the housing staff. She shared this strong remark with us about how helpful it was to use Alexa to remind the time for medications in terms of sleep quality. So basically, this person was saying that one of her residents didn't need to worry about if he's going to miss his medication. So during the Alexa evaluation project, my team applied for and received the NIA funding to develop prototypes of smart speaker-based functions that could enhance social connectedness and well-being in the community setting. We completed the data collection early this year, and we are working on data analysis currently. And Dr. Rachel Wood, who is here with me, will share her experience of working on this project after this presentation. So the goal of this study was to examine how smart speakers can support the needs for social connectedness in low-income older adults. Studies report that a large proportion of older adults are affected by social isolation due to many reasons, and low-income older adults are disproportionately affected by social isolation. So we thought that it's necessary to develop innovative approaches to mitigate these issues. So our goal was to develop low-fidelity prototypes of smart speaker functions. And low fidelity prototypes is a kind of informatics term, and it indicates a low tech and straightforward type of prototype, and it's mostly used during the early stages of technology development process. Despite the potential benefits of digital technology, including smart speakers, some unique challenges to the adoption and use of the technology exist, particularly among people with racial and/or poverty-related disparities, such as the population that we serve. To design and implement technology solutions that can adequately address health issues and support well-being in their living context, it is important to engage them in the design process. So it's not a top-down approach. So we wanted to really hear what their concerns are, what they want to use through this speaker system, and what implementation barriers are out there that we should consider. This slide shows the study process. And participants attended in a series of 3 focus groups. We took an iterative approach to reflect their needs and expectations in the technology design process and inform the direction for the next cycle of technology development. So my presentation today is mainly focused on the first phase focus groups, where we had 2 rounds of brainstorming to discuss preferred tasks and functions of smart speakers. 25 residents from 3 buildings attended this design process. Our target population was older adults aged 55 and older and living alone in low-income senior housing. We had 2 groups of participants. First is smart speaker users from the building that I mentioned earlier. And the second group of participants was those who had not had any experience of using smart speakers. So I want to briefly share what participatory design strategies we used in the first phase, given that many of the low-income senior housing residents have less exposure to this type of research process, and they lack digital technology ownership. So we took a fast brainstorming approach for generating ideas. And we limited the number of each focus group to 6 people to allow for more intimate conversation and sharing. Second, we had separate focus groups for users and non-users. So users had far more experience of engaging with this technology, so we thought that they had more detailed ideas about preferences and perceived barriers, and we didn't want their ideas and thoughts to influence the thoughts of non-user participants. Also, we wanted to encourage any ideas and thoughts among non-users, which could be very innovative and breakthrough thoughts. For brainstorming, we formed mini groups of 2 to 3 people to make sure everybody has a voice. Each group had a facilitator who was a study team member. The ideas our participants generated were shared in their mini groups. We used the 6-8-5 design method, where participants were encouraged to generate 6 to 8 ideas in 5 minutes. So it's a fast brainstorming. After the 6-8-5 method, they returned to larger group and shared what ideas their mini group generated. Other people who are not part of the mini group had a chance to ask questions and share their thoughts. And the facilitator summarized all the discussions and concluded the session. During the focus group sessions, we were able to hear what our participants needed and wanted. First of all, since all of them were living alone, and we met for focus groups during the pandemic, almost everybody felt lonely and isolated, and they really wanted to have some technology tools that could mitigate the issues of living alone. The next thing we found is that our participants were primarily interested in using a smart speaker for safety and health. They wish the technology to be functioning as a tool for safety, as I mentioned. And in terms of social connectedness, which is the key topic of this NIH research, they voiced the need for making their community more livable and connected. They expressed the desire to use the speaker to check in on each other or make more connections among their residents. So they shared a lot of great ideas and thoughts with us. A total of 149 unique ideas were generated, and we looked through them and sorted them out to make categories. And as you can see here, daily assistance and health and safety are the 2 most preferred areas of the smart speaker use. There are 2 categories related to social connectedness: socializing with others and companionship with the virtual agent Alexa. And they had desires of using the technology in other purposes too. Since the focus of the Voice to Connect study, this NIH study, is social connectedness, we try to find ideas that are relevant to this area by looking through the shared ideas. Some ideas were clear, while others were somewhat vague, and we were trying to find the nuance of those ideas and create use case scenarios. And I'm going to share one of the examples in a few moments. So you can see 4 main design concepts that are relevant to social connections, including checking in, social companions, social participation, and wellness check. And each of these categories have 2 use case scenarios, except for the wellness check category. So here I put one use case scenario in the category of checking in. So this scenario describes the interaction between the user, virtual agent Alexa, and the housing management for the resident to get a check-in message from the management. So based on the thoughts and preferences of our participants, we developed this scenario and had another round of discussions to get their thoughts on the initial scenario, and we revised the scenario to reflect their concerns and thoughts. So far, I have been presenting how smart speaker technologies can be perceived and used to help older adults age in place by addressing some of the health issues they have. These 2 studies inform the team of the next steps in terms of what types of smart speaker functions we could develop in our future projects. And I'd like to switch gear a little bit here and talk about some barriers to uptake of technology and how we can support older adults' smart speaker use. So next study I'm going to talk about is a Very Well project. And this is an ongoing research project and has been supported by the Firestein Innovations Award, the School of Nursing. Okay, so here I listed several user challenges and barriers to technology uptake in low-income minority older adults. So one of the challenges we have found through several technology projects is user difficulty and lack of usability. So they really are motivated to try out new technology, but there's a lack of training, lack of support. And the user difficulty ultimately leads to frustrations and disappointments, sometimes leading to giving up on the technology. Second, the right to privacy is recognized as a core issue that should be discussed in order to appropriately use smart speaker technologies. For example, smart speakers collect voice data about users, but information about the home environment may also be accessible. And there's always a possibility that collected data are shared with unauthorized personnel without permission. So our participants shared their concerns about privacy throughout the study process. It is also important to be aware that technologies and devices may not have been designed with the specific needs of older individuals and their caregivers. Last but not least, equity of access. These digital health equity issues are mentioned a lot by researchers in these days, and I feel like I should do something to tackle this issue. So universal access to technology and necessary training is the first step to supporting older adults, any older adults, to benefit from these technologies. Equal and fair access to technology and related information is not always possible to everybody. Cost is definitely a factor impacting this, and internet access, education, and income level, and where you live are all related factors. So to tackle some of these issues, my team started this project. So very well is an acronym of Voice Technology Education and Resources for Improving Well-being among Older Adults. In this project, we aim to develop instructional materials to improve digital literacy and self-efficacy in smart speaker use among low-income housing residents. And we use, again, a user-centered design approach to develop these materials. We engaged smart speaker users and 5 non-users, as well as housing management staff. Data collection is underway, and we had several interview sessions with our participants to hear what they prefer, what they want to learn more about the speaker, and what types of instructional materials would be helpful. So based on their feedback, our team has developed 5 instructional videos. We used the co-design approach to identify smart speaker functions they wanted to learn more about. And we co-developed the scripts of the videos and invited 2 study participants as actors, so they appear on the videos without faces. Here you can see the list of preferred functions for the videos, and we also created a brochure so they can bring it home and attach to a preferred location and see what comments they can say to enable a specific task. Here's a screenshot of the brochure material. So our plans for the next step is to conduct several interviews with our participants to get their feedback on these materials and find a way to improve them for future use. So I want to finish my presentation by sharing some important lessons I learned from these projects. So first of all, it's important to work together with the housing management and their staff and other stakeholders to introduce the project to their residents and encourage participation. Because low-income older adults have been traditionally excluded or ineligible for a research study due to many reasons. And it is important to set up a trusting relationship with the community. In this regard, support from the housing staff and RHWP is critical for the success. Second, it's critical to consider unique demographic and social cultural characteristics of the potential users to select the right type of technology to support aging in place, and also choose appropriate strategies for discussions of user needs and barriers. Third, it's important to keep in mind that the degree of previous experience with technology is varying from person to person. So this group is not homogeneous. So we have to consider all different types of factors and characteristics. Fourth, it's important to address their fear, privacy concerns, and lack of confidence in technology use, especially among those who are less tech savvy. Last but not least, I learned that there's a need to create comfortable environment and trusted relationship with our study participants and incorporate their feedback into the early stages of the technology design. In this sense, participatory methods allowed us to have this kind of environment where participants felt safe and comfortable, and they expressed their thoughts, concerns, and preferences with the study members, which was the key to success of this project. Despite the barriers and ethical concerns, new technological advances present possibilities for older adults and their caregivers. If planned thoroughly, designed appropriately, and implemented carefully, we can see benefits outweigh harms, and eventually technology can support healthy and independent living for older adults. So this is the end of my presentation, and I'll give my baton to Rachel.
Hello. So I am Dr. Rachel Wood, and like was mentioned earlier, I'm an assistant professor here at the VCU School of Nursing now, but I'm also a VCU alum, and I did my PhD studies here. And while I was here studying, I worked as a research assistant on the Voice to Connect project that Dr. Chung just shared about. And I joined this project because my work is somewhat related. My research is on healthcare provider well-being, and it's specifically on how loneliness may be experienced by clinicians and how social connections can improve wellness in healthcare providers. So when I learned that Dr. Chung was doing a project that explored social connectedness and opportunities to improve sense of connection, I was very excited and honored to be a part of it. So as a research assistant, I truly enjoyed working on this project because it offered me some great research perspectives and some opportunities that were invaluable as I progressed through the PhD program. A big part of my role on the study was in conducting the focus group sessions with the participants. Now, we'll point out that we did these during the weirdest part of the COVID pandemic, where the first few rounds were happened while there were still some restrictions in place about gatherings and the size of gatherings and where they could be. And particularly in the housing buildings where these residents lived, there were still some pretty strict restrictions on gatherings in those buildings. So to adapt this, we followed all the CDC guidance, but we were able to bring the participants together here at the School of Nursing building, and we could use a large room to allow for these conversations to happen and everyone to talk while still being spread out enough and maintaining that distancing that we had to maintain early in the pandemic. I will say that it was very fun to interact with the participants as we gathered them at the School of Nursing. There was some inherent downtime in the getting them there and settled and everything, and afterwards as well. And several of them were joking about wanting to go out on the town to party after the focus group sessions. So it was really fun to interact with them informally, as well as facilitating the actual discussion during the focus groups. So again, it was truly an honor to get to lead the focus group sessions and to learn through that experience. And I found it really helpful to take time to hear the voices of these participants. I found that I had to very intentionally set aside what I thought I would hear and truly listen to what they were sharing. And I loved hearing what they thought about smart speaker technology. And I was often surprised with how open-minded they were about the various functions of the speakers and with how much they already knew about and used in them. Some participants in both the user and non-user groups were already using video calling on their cell phones or other devices to stay connected with their friends and family members during those strictest isolation phases of the pandemic. So they were already searching for technological solutions to stay connected. Other participants who had the smart speakers were already using features like reminders, timers, to play their favorite music, or even listen to news or audiobooks. So I was very surprised at the level that they were already engaging with the technology on a daily basis. I was also very delighted to hear that they truly wanted to learn more about the available technologies, and that with the right training and support, they were willing to embrace new products and features. They very much seemed eager to learn about the technology, but they did commonly emphasize that they wanted someone to take time to help them get it set up, learn to use it, help support them when they had troubles. So that was very much a common theme in the Voice to Connect study that the Very Well study did address. They also did share some concerns about privacy, and several mentioned that the technology shouldn't ever replace true human connection. And I definitely appreciated that part as my focus on social connectedness with peers in my research. So all in all, this was a very valuable learning experience for me as a student research assistant, and I was honored to be a part of the team. I was able to learn a lot about study logistics and adapting things when they don't go as planned. And I learned a lot about a different aspect of qualitative research. In my research, I had been using individual interviews, and in this study, I was able to explore using focus groups and user-centered design features. And I also learned about research teams with members across various disciplines, as this was a great multidisciplinary team. I also appreciated being able to look at social connectedness from a different lens. So as I mentioned, my work is around loneliness and social connectedness in healthcare workers. So it was wonderful to consider loneliness in this different population and hear perspectives from these participants about how technology can impact their sense of connectedness. So I'll continue to use many aspects of what I learned through this opportunity in my future work. And I certainly hope to start engaging PhD students in my studies so that I can continue to share these lessons moving forward. That's all I have today.
Well, to Rachel and to Jane, thanks so much to both of you. I really appreciate personally being able to kind of hear from you and to kind of really get a deeper perspective and understanding into the work that you've been doing over the past several years. So I really appreciate it. And, you know, it's about 2:45, and I think our event, you know, we're slated, we've got time until about 3 o'clock. And Laura, you had shared that there were no pre-submitted questions. I didn't see any questions specifically come through to me to the chat. But Laura, Catherine, did anybody send anything to you that they were curious about?
I don't see any questions as of right now.
Okay.
But if you do have questions, please feel free to come off of mute or put your questions in the chat. We're happy to answer them.
Yeah, yep, absolutely. Feel free if there's anybody who is curious to hear more about Jane's work and Rachel's participation, definitely come off of mute. We'd love to hear from you. And while you're thinking of questions, I think, Jane, I'm curious to know from you. So when you were going through your presentation, you mentioned that you were focusing on, I think, kind of, I'll call it phase one. Is kind of what, now, could you, is there anything though that you might be able to share for the group regarding the couple, like stages, phases 2 and 3, if those are phases that you have started on or not? I'm just kind of curious.
Yeah, I can provide more information. So we've completed all 3 phases of data collection.
Okay.
So during the phase 1, we did the brainstorming. So it's heavy brainstorming focused sessions. We had 5 focus groups for the phase 1. And across 5 groups, we heard a lot of thoughts and ideas from our participants. And based on the feedback, and we also asked them to draw some ideas on a pictorial sheet to assist with their brainstorming. Anyway, we used several materials to assist with user-centered design method. They write down their ideas on those sheets, and we analyzed those data and listened to the focus group sessions, interviews, and picked out some ideas for the social connectedness. And the team has collectively created those ideas in the 4 main categories. And we created the scenarios, examples of use case scenarios. And we brought those ideas to the second phase session. And so that way they can see what we are trying to do, what we want to get out of these discussions. And they can see clearly what would be the interaction between the user and the virtual agent Alexa. And they started sharing a lot of ideas and thoughts about some actual and very helpful ideas for revising those ideas. So after second phase, the team gathered together and talked about this, and we kind of revised our ideas to incorporate their privacy concerns and other types of implementation barriers. So we brought these revised ideas to the third phase focus group sessions and heard what they were thinking about those, and unanimously most of them liked most of the ideas, and they also shared some thoughts about voice user interface. So this is a very technical term, but the Alexa speaks to you in a female voice as by default, and it has its own accent. And we wanted to know what accent they prefer, what voice they would like to, and the speed of the speech, all these types of different linguistic and speech characteristics. So we gathered that kind of information. So these are very lengthy process, but it was fun. And Rachel was phenomenal in this process.
No, I appreciate you expounding on that. And is there anything that you might be able to share in terms of kind of work from here or goals from here related to your various projects?
So actually I submitted another NIH grant in October because there was a specific call about developing the AI technology. So we selected one of these ideas in the wellness and mood check. So I was able to make a collaboration relationship with one of the computer science faculty here at VCU. So our idea in this application is to build a smart home system that incorporating the smart speakers. So basically, we can put some sensors in home, and that can measure the level of social interaction or social connections and mood of the loneliness. And it can send the data to the smart speaker, and the smart speaker agent can say something to the participant, the older adult. So I'm hoping that the reviewers will like the idea and make a decision to fund our study, but we'll keep going.
No, I appreciate that. And no, I can think, Jane, of family members of my own who, if they were to kind of be working with you or Rachel or others, that they would have the same thoughts and feelings in terms of trepidation, I think, initially towards the technology. But I, meanwhile, could see, just some different positives that they would really benefit from. And also, someone like me who doesn't necessarily live right close by my family members, being able to have some peace of mind as well. Just kind of knowing that there's some sense of being checked in with, and to be able to have that peace of mind. So I don't know, I was just kind of got my own wheels spinning as I was listening to you all talk. And I'm just curious, feel free, I'm just trying to check here to see if anybody else has taken themselves off of mute. It's certainly not my intent to monopolize the Q&A here. I see here a couple of people who have made some general comments. Sean, who came on, he said, thanks, this was great. And also Dr. Marcia Shade, she says this was a great talk. She is doing some work in this area as well. Wonderful, Marcia. That's awesome.
Great to hear that. I'd like to know more about your work.
Marcia, I'm not sure your affiliation with VCU and such, or how you got to know about today's presentation.
I'm just going to take myself off of mute. I'm at the University of Nebraska Medical Center, College of Nursing. One of my colleagues, Dr. Kristen Dickinson, she did her Ph.D. there, and she sent this to me because she knows that I'm doing work in this area. I'm actually doing a study using Amazon Alexa, and we are doing prescribed routines for loneliness and pain management and things like that are programmed into the Alexa. And we're looking at outcomes related to that in older adults. And then I'm also doing some similar work with voice assistants and pain and so on and so forth. So this was a great talk, and I've read your work, and I'm excited to see someone else doing this important and innovative work. So kudos to you.
Thank you so much. I think I read one of the articles on smart speaker from University of Nebraska.
Yep.
So
Yep,
maybe
that's
it's
me.
you. It's great to connect with
We
you.
should connect. I'll send you an email.
Yeah, that would be awesome. Please do so.
That's great. Well, Marsha, I appreciate you chiming in. All right, anybody else before we kind of conclude today's talk? I'll take a last call here. Just doing a double check here. All right, it looks like we have our folks who are still muted. All right, well, but before we hang up, Laura is going to send out a short survey to everybody who attended today. What we do is appreciate hearing your all's feedback, specifically about the event today, but also if you have any ideas for future topics for virtual events like this, we just appreciate hearing what you all have to say. And also a recording. We will make sure that we, as a courtesy, send it out to you all, as well as for folks who weren't able to join us today. I think that's it. Laura, did I miss anything?
That's everything.
All righty. Well, everybody, thanks so much for joining us. Really appreciate it very much. And until the next time, have a great holiday too, okay?
Thank you for organizing this event, Pam and Laura.
Absolutely.
And thank you everybody for attending
Of
here.
course. Appreciate your participation. Thank you.
Bye.
Bye.